So in this demonstration, we're going to show how to treat the anterolateral lower leg. So again, we're going to begin by wrapping at the more distal portion, just underneath the main bulk of tibialis anterior. So we'll get our anchor in place and then a 50% stretch across the main bulk of tibialis anterior and the fibularis muscles and a 50% overlap. And you can see here, as we're wrapping round, we're using a thumb on the shin to just anchor that tape and allow us to provide that stretch over the main bulk of the tibialis anterior and fibularis muscles. The idea here is to try and direct as much of the compression onto the area that we're aiming to treat. That's the theory behind applying the stretch over that area. So once we finish wrapping off, we will tie off into that position like we usually do by slipping a finger underneath one end of the tape and pulling through to secure in a nice tight position. And then from there we can begin to move the ankle through ranges of motion which will target the anterolateral aspect of the lower leg. So as always, some circumduction and then more towards inversion and eversion to provide a bit of flossing and stretch into those tissues of the tibialis anterior, fibularis brevis and fibularis longus. We can then get up onto our feet and take the ankle through some range of motion into dorsiflexion like so, just challenging the tibialis anterior a little bit more in this aspect. And then from there, as always, we can add in a nice little stretch at the end, this time in a kneeling position, targeting the tibialis anterior muscles. So to set this up, again, we'll be in 4-point kneeling and have the foot on a yoga block like so, and then we can sit back on to the heels. The more weight and the higher posture that we have here, the more intense the stretch will be on the tibialis anterior muscles, and the further forward we sit over the knees, the less intense it will be. And again, we can rock backward and forward in a pulsing motion on and off the stretch.